guys all do different types of psychotherapy. So, and you do, and also different types of training, which is a bit confusing. But yeah, what do you do?
So I'm currently into my third year as a dual trainee in general adult psychiatry and medical psychotherapy. So I'm doing an integrated program where actually my timetable is split between these two disciplines, which is a very concrete way of bringing these two different ways of thinking into a dialogue. I mean, between Monday to Friday, you have to flip between very different ways of thinking, and that can be quite challenging but rewarding as well.
So I'm doing a single CCT, so I just do psychotherapy at the moment. And that felt important to me to be able to do that. It was something about being able to immerse myself in this new culture. And I feel very grateful that I can do that each day at work. Starting in the first year, I had a couple of psychoanalytic or psychodynamic cases, and then one afternoon a week was all about systemic therapy. And then over time, I've done less of the systemic and had more and more of the psychodynamic cases, and then start to take on psychoanalytic cases who I see 3 times a week, and then also have maybe once or twice a week see a patient for CBT. So
You do a bit of everything.
Yeah.
And we all do.
Yeah. And as well as seeing individual patients, I also have a group. So you get a difference between working with patients individually and working with patients in groups.
I'm actually doing a non-integrated training programme, so I'm starting with 2 years of medical psychotherapy. I'll then do a partially integrated year and then 2 years of general adult. So it's slightly different to what you were describing with mixing it all up in the week. But no, my primary therapy modality is CBT, which is cognitive behavioural therapy, which I'm really, really enjoying. Working on the national OCD ward at the moment, which is for patients with very severe obsessive compulsive disorder. And it's a lovely therapy to be learning. It's quite hands-on, it's quite creative, and we get really great results. It's lovely to see people getting better.
I, with you, have been the architect of the dual training. My concern is to hold on to the single CCT and really make that clearly seen as it were, using a medical analogy, as the stem cell of medical training. It's pluripotent. It can become many different things, and the link with forensic psychiatry predated the link with general adult psychiatry. The child and adolescent psychiatry dual that we're developing is a further development, a natural one, I think, developmentally. We might think about liaison psychiatry in terms of somatisation, developing that, beefing that particular aspect of general adult psychiatry. Intellectual disability, another partnership that we might think about in the future. But a number of different ways in which the core identity of a medical psychotherapist might...
We wouldn't want to lose the single CCT, and there'll always be trainees, well, as long as there are trainees, and I think there always will be, who want to train in a single CCT. I'd want them to have that opportunity. And we have discussed this recently, and I've just been surveying the heads of schools, and quite a lot of schools are still planning to offer a single CCT. It's not all going to dual training, which is good.
The day-to-day job is just great. You get a wonderful mix of research time, teaching opportunities, academic learning, seeing patients. Obviously, that's a wonderful part of the job. It's just a really great balance.